Now, if you are dealing with pain, it can disrupt your life for sure, and you may be looking at any possible way to cure it.
Well, have you thought of autonomic body therapy, if I can say it, or do you know what that is? Well, Dr. Michael Austin is here to explain. Welcome, doctor. It's good to have you.
Hi, good to be back.
And so there's a lot to be said, as we were saying a little bit before the show, about the mind-body-spirit connection.
For sure.
And would you say that autonomic body therapy combines all of those?
Most definitely. I think principally for the Western part of medicine, I would explain autonomic body therapy as working through the nervous system, specifically the autonomic nervous system. Most folks are familiar with the central nervous system, the brain and the spinal cord. Autonomic nervous system, segments of that lay outside of the cord, and the segments called it chain ganglia. There are twigs of that nervous system then that go into the cord, but it regulates all of our internal organs, our breathing rate, our heart rate, even goes into part of the limbic brain where the emotions are held. And twigs go to the eye. I've had some folks that come in and it didn't correct their vision, but they said that just their vision felt clearer all of a sudden through a treatment. So it was pretty remarkable. So it has a very broad effect. The nervous system being one. I've had other emotional responses can happen again as the body releases emotions through that limbic part of the brain. The technique itself is more hands-off than hands-on, and that some people have trouble with because they think you really have to get in there and dig in the tissues to get a comfort, and that's not so. You really just have to initiate the response, these reflexes that are inherent in the body, and let the body do all the work for you. I like that because I'm a lazy practitioner, so the less I have to do, the better. One of the remarkable things I found several years ago, there was a conference in Harvard that was on fascia. Fascia doesn't get a lot of press unless you're maybe a massage therapist or a rolfer. Fascia is crystalline microscopically, and when you push on a crystal, it releases electricity. So fascia is the most abundant tissue in our bodies. As I was saying earlier, everybody's seen fascia, but we haven't really paid much attention to it. When you peel the skin off of a chicken leg, that white cobweb that's in there, that's really, really slippery, that's fascia. So when you do these small moves on the muscles with autonomic body therapy, what I'm actually doing is pressing on these microscopic crystals. Those crystals release this electrical charge that goes off actually almost instantaneously through the entire body. When that charge comes to an acupuncture point, then it will, as an acupuncture point is a low electrical node, electricity likes the path of least resistance, so it goes down the little point and lights up a meridian. So you can work on, let's say, somebody's neck, and they can have sensation down on their foot because the energy is traveling through the meridians. What's really cool about fascia, and this is what I learned from the conference in Harvard in 2007, there's a architectural term, it's called tensegrity. Tensegrity is from Buckminster Fuller, built geodesic domes. So geodesic domes with that tensegrity model, if you grab a hold of the cable and pull on that, the entire structure moves to that. The whole structure essentially feels that pull. Our bodies are built the same way. We have our long bones, which are the poles, like in the geodesic dome, and the cabling would be the muscles around them. So when from this conference at Harvard, what they talked about was that down at the cellular level in our body, the cells are actually built the same way. So effectively, when I do a move anywhere on the body, the entire body down to the cell feels that.
And so you're talking about everything from, your eyesight being a little bit clear, from being able to feel something in your feet from your head. So who is your ideal, patient that this would work for? What part of their body could they be dealing with?
I've treated probably most effectively. I've seen best results with rheumatoid patients over the years. Another disorder called complex regional pain syndrome. It's a lesser known thing. The pain is incredibly intense. Of course, that's relative. Anybody that has pain thinks it's really the worst thing that they've ever experienced. But those two populations do quite well. With the complex regional pain patients really don't have any outlet other than pain management physicians who do meds, injections, and surgery at the end, where they're actually cutting those twigs from the chain ganglia that are part of the autonomic system going into the cord. From my perspective, it's traumatizing a system that's already on fire effectively by cutting that, but that's what they do. Surgeons cut. So.
Well, I love this therapy. I mean, it's a non-invasive way, and what you're really doing is you're tapping into the underlying structures of the body.
Absolutely.
And making it better through autonomic therapy.
Correct.
Well, I think this is great. Doctor, thank you for coming and explaining this to us.
You're welcome.
And as a special for the first 3 new patients, you can receive a free DVD on treating low back pain with this therapy. And for more information, you can call 887-2428, or you can log on to drmichaelaustin.com as well.